Let me recognize at this moment our Director of Primary Healthcare, Dr. Jeffrey, our GNC President, Mrs. Augustine, and Dr. Shirley Curtis, our Regional Midwifery President, and also NFPA representative, Mrs. Deborah Lewis, and our country presidents from different countries that is represented here, and those who are online, and colleagues. Let me, on behalf of Ministry of Health, Social Services, I welcome you to the Nature Island of the Caribbean.
That's us.
We are honored that you chose Dominica this year to host our midwifery meeting. Our heart at this moment, I cannot but remember our colleagues, our sister island, who suffered the devastation of Hurricane Beryl. Our prayers and support are with them. And I know that we as nurses have something in place to support other than prayer. And this is important because when it was our turn, we also got their support. Our heart goes out, and so this year could not be a more prophetic theme. You know, midwifery, a vital climate. So who came up with this?
I see it. International Confederation of Midwives.
That person is a prophet.
The jinx effect.
Because in this moment that we are now, we are experiencing history.
Yes.
We are the second name storm is in June. People plan their holiday in June because they know they have to be back. In Dominica, we have to be back by the end of August to September. We need to be back in country, you know, so we can weather the storm we expect to come. So we are realizing that history is, and again, you can see the effect of climate change. And furthermore, you say in Dominica, you're in Dominica. And in this, if you speak to anybody, small and great, they will vividly tell you the effect of Hurricane Maria since 2017. You know? So we are in the right place, the right theme, at the right time. So climate change has impacted every sector in our society. Maternal and child health and sexual and reproductive health services is not exempted. And so we experience firsthand the psychological and the financial effect of natural disaster to the country, and particularly also the family. COVID-19 pandemic caused fear and panic to our customers, and you know who our customers are, the clients that we serve, right?
Right.
Which evidently decreased access, not even access, but you know, refusal. We see refusal of persons due to COVID-19 to access care, especially to their children. So healthcare and vaccine. So healthcare workers, particularly midwives, are still pleading, even now, with mothers to breastfeed. Remember during COVID-19, there was a whole discussion about breastfeeding? Right. So persons are saying, no, they're not taking a chance. Persons decide they are not taking a chance. So we still have to still tell persons breastfeeding, 6 months exclusive breastfeeding is the best. We also have to tell people to take their vaccine, the childhood vaccine, give their children the vaccine because of COVID-19 vaccine that they had their fear about, and thinking that in all the EPI vaccine is COVID-19 that they don't want to give their children. So we're still battling with that. But we as knowledgeable professionals cannot give up. Never before Dominica has experienced low vaccine coverage as we did during the pandemic period and also Hurricane Maria. Antenatal care suffered significantly. during this time. Additionally, we are still battling with the health staff attrition. Some of us are taking our staff. So in case where you someone take their
Take themselves. Take them.
we are in Dominica. Midwives are sought after due to this their level of training and their ability to multitask within the healthcare continuum. It is evident that midwives are regarded by the community and their work colleagues as professionals who are trustworthy in the provision of competent healthcare. Therefore, calling on midwives to become the vital climate solution is well understood. Yes, the midwives, the numbers are low. I don't even want to tell you the numbers. It's low. Patient midwife ratio, it is not ideal. But however, all pregnant women who access service in the public system, 100% were conducted by midwives. Give yourself a hand of applause. Furthermore, with the exception of COVID-19 and Hurricane Maria impact years, Dominica celebrates immunization coverage at an average of 95%. That's why when it's below 95%, we cry. We cry, you know? So we have been upholding the 95% and above for many years. Again, this high percentage coverage is due to the effort of our midwives in collaboration with other healthcare workers. Midwives further contribute to the general well-being of the populace and provides home and household visits and follow-up care to elderly and vulnerable